I'm really delighted to present this work, and I would like to thank the department so much for the seed grant. It's very rare that I get to disclose a conflict of interest of any sort or of any kind of funding. So this is really fantastic, and it's been a huge help to our work. And so, by way of introduction, I want to talk a little bit about the organization Lifebox, for which I'm a consulting medical officer. So Lifebox is a charity. It's registered in the US and the UK, and we also have a legal entity in Ethiopia. And Lifebox was founded out of the creation of the WHO surgical safety checklist, because on the checklist is one of the items on the checklist is actually the use of pulse oximetry for routine monitoring of patients. And during the process of developing this checklist and disseminating it and working on implementation, we realized that pulse oximetry was going to be a huge problem for many resource-poor or resource-variable settings, because there was not a low-cost option available, and it wasn't actually available for routine monitoring. So Lifebox as a charity was established to help kind of fundamentally address some of the problems and issues with surgical safety globally. And one of the first items that we focused on was the development, procurement, and distribution of a low-cost pulse oximeter. And so we've now distributed over 28,000 oximeters in over 110 countries. And frequently the oximeter that you can see up in the upper left-hand corner is one of the only monitoring devices that patients will have, both for anesthesia, post-op recovery, and even in the wards. Now, obviously with coronavirus, this work has become even more important. But it set the stage because the work that we do as part of this organization is really very much done in partnership with providers. And so we work with providers to understand, what kind of challenges and problems they face, and it helps us identify new opportunities. And that helped us identify this issue of surgical lighting. So imagine that you are in a country, kind of a resource variable setting, and your sister is undergoing a cesarean delivery. And so this might be her experience. So it doesn't take much imagination to understand how this actually could be a huge surgical need and a huge surgical safety risk. And so in working with partners, we identified this as surgical lighting as a major issue. And so we undertook a process of human-centered design, essentially, a little bit modified, because the solution we already have a sense of, right? Surgical headlights already exist, but surgical headlights for this type of setting don't, and certainly not at a price point that makes it widely available. And so we undertook this kind of process of problem identification, understanding what the surgeon's needs and their use cases were, market research, and then identifying and ultimately procuring a low-cost surgical headlight that would be appropriate and useful for surgeons wherever they might be working. So the first part of this was really around problem identification and an initial surveillance work. And for this, I really want to give a tremendous shout out. And much of this work is really thanks to one of our own graduating surgical residents, Jared Forrester, who during his research time spent 2 years in Ethiopia working on a surgical safety and quality improvement initiative. And during his work with partners in Ethiopia, he and colleagues started identifying and building out this concept of surgical lighting as a huge safety risk. And so here's some photos that he's taken from the operating room in Ethiopia. And you can imagine it's not hard to recognize that lighting is definitely inadequate. Even in times when you have overhead surgical lighting, the surgical lights themselves, the overhead lights, may be inadequate for really good surgical field illumination. And so when you have a case where you're working and suddenly your lights are non-functional, there aren't very many options for field illumination. So here you can see there's a medical student, holding his cell phone light over the surgical field in order to illuminate it to complete an operation. And so Jared undertook a survey of providers around the world actually to understand what the problems were in surgical lighting. And you can see here that there is, obviously a group of hospitals that certainly have no problems with surgical lighting, but most hospitals actually do not have excellent surgical lighting. And in fact, half the hospitals have poor or very, very poor. Half the respondents noted that their hospitals had poor or very poor surgical lighting. In a survey of 100 providers from 39 different countries, 80% of those reported that the lack of lighting was a severe patient safety issue. 50% reported power failures at least once a week in their operating theaters. 20% directly knew of patients who'd been affected because of either poor lighting or interruption in surgical lighting, but less than 10% actually had their own headlight to use either as a backup or as a supplement to surgical lighting. And so our next step really, so we understood that this was a need. So then we looked at what the market looks like. And part of the way that we do this is just setting some specifications. So if we were going to go to a manufacturer needs to know what we're asking of them in order to deliver on a prototype or some engineered device. And so once again, Jared undertook the yeoman effort of really identifying the specifications using this human-centered design approach. And we published this in JAMA Surgery a few years ago. And really we had these kind of 4 main domains. There was this domain of lighting. So what is the specification around lighting? What's the quality of it, the intensity? How uniform does it have to be from edge to edge? What's the color temperature? Is it a warm light? Is it a cool light? How big does the spot size need to be for this kind of environment? What is the mounting like? How much movement does it have to be? What are the use cases? We think of issues in surgery, but a lot of the surgeons are evaluating patients on the wards in the middle of the night where the lighting may be inadequate. You have obstetricians and gynecologists who need to look up a birth canal. So rather than looking down at the field in front of them, they may be looking more straight ahead. Or if you're doing perineal evaluation, you may need a headlight that looks straight ahead rather than straight down. How much does it weigh? How comfortable is it? What is the battery quality like? How long does the battery have to last? How quickly does it need to recharge? Does it mount on a head or does it mount on the clip on your belt? And what's the quality of the battery itself? And then the durability is really important, right? So the problem in a lot of settings is that there's no process for procurement, distribution, and maintenance of machinery and devices. So the materials really have to be durable, and you have to be able to MacGyver, so to speak, a device. So if you accidentally cut your cord, or if you accidentally crack the battery case, you have to be able to fix that locally using local, materials. You also have to be able to clean it. It has to be splash resistant. It has to be able to work under extremes of temperature, very, very hot, very, very cold. And the battery has to withstand charge fluctuations that are not infrequent in many of these settings. So once we've developed a set of specifications, we also need to entice a manufacturer to get into the market. And so we undertook an assessment of how many surgeons might find a headlight like this very useful. And so we identified based on where surgeons live and the proportion that are living and working in these kinds of settings, and the inadequacy of lighting in many settings, there are probably about at least 400,000 surgeons working in resource variable contexts that would benefit from a surgical headlight. There are probably about 37 to 40 million patients who undergo surgery in these environments every year, where they're at risk either for delays, cancellations, or interruptions of surgery because of power outages or inadequate lighting. So now you get a sense of a market size as well for a manufacturer. So we then went forward with an expression of interest from manufacturers seeking to understand, to request manufacturers to submit for possible large-scale procurement, and also to understand what the devices look like. And then we took a selection of devices and tested them under very kind of consistent engineering settings. The problem with surgical headlights is that there's no standard. So manufacturers report headlight intensity, but there's no standard for the distance, right? So the intensity of light changes depending on how far away you are from the light source. And if you don't have that standard, then one light that may be reporting high intensity is actually putting that intensity measurement very close to the bulb as opposed to another one. Based on this evaluation, we identified products that ranged in price from $40 to $2,500. The lower end products were probably not worth the money that were spent on them. But once you got over about $800 to $1,000, you started getting into fairly decent headlights, maybe medical or surgical grade headlights. But again, the price point was really, really tricky because this is a very, very expensive light for a lot of these providers. And it's certainly hard to scale at that kind of price point. In addition, there was no light, none on the market that was bright enough over the 3 hours of time, had a focused spotlight, had cables and materials that were easy to replace, that were resistant to power surges, that were durable and had a long-lasting head strap. And so, in addition to not finding one that was suitable for our circumstance, we also identified that there's a huge opportunity, right? We know that LED prices are getting cheaper. We know that battery prices are the lithium-ion batteries are getting cheaper. So there's a gap between where the price point is and where we actually think the materials to make this kind of light from the beginning are. And so essentially we evaluated over 100 different headlights from companies in 10 different countries. We eliminated the very, very expensive ones because we knew we weren't going to be able to scale those at the kind of level that we're talking about. We tested the light and the battery of 7 selected models under controlled circumstances, and then we selected 5 for field evaluation. And we did some little trial testing actually here at Stanford, just asking some surgeons to use some of the lights that we identified in their own operating rooms, or just wear them and see how they fit. And then we also asked surgeons in Addis Ababa, Ethiopia, to try out these lights. And these included surgeons from orthopedics, obstetrics, general surgery, pediatric surgery. So a variety of different types of surgical use cases to see how well these lights, fit their particular needs. And so the results of the field testing were very interesting. Of the 5 headlights, there was one that I would call an industrial headlight. So it's not like a camping headlight. It was a headlight for tradespeople or skilled workers who would be doing, say, hardcore plumbing or fixing a train or working on power cables at night. So a really robust headlight, but it wasn't really fit for purpose for surgery, but it was a very high quality light. And then there were 4 headlights that were specifically made for the medical/surgical environment. And we evaluated these amongst the surgeons that were using it in a number of different ways. We had the surgeons keep a logbook, so they would use various headlights for 2 to 3 weeks and keep a log of the cases, and then how well the lighting worked in their circumstance. And then at the end, they would look at their logbook and they would rate the headlight. We then went and did some qualitative interviews, asking them about how they would use the headlight, how they transported it, if they had any problems, if they ever dropped it, if they forgot it, if they didn't use it, why not? And then created a rating scale based on those interview feedback. We then had them, all the surgeons test the headlight head to head. So we invited them to dinner. We had them try out all the different headlights kind of back to back to see, so they could compare them directly rather than over a 2-week time period. And then we asked them how much they would pay out of pocket for a light. And you can see model 1 here actually came out quite a bit ahead. And this actually ended up being the industrial headlight, not the medical headlight. There were medical headlights that performed much worse actually than this industrial style headlight. And one of the key drivers, not surprisingly, once you've got over the quality of the lighting and the quality of the device itself, was price. And the price point was a huge issue, so that surgeons in these contexts were really price sensitive, and that made a huge difference. If they could if they could get a headlight for a fraction of the cost, it made a big difference as to whether those surgeons would be willing to purchase such a headlight out of pocket. So I'm really proud to announce that this is actually the surgical headlight. We're working with a manufacturer. This literally just arrived. This is our third prototype that literally just arrived last week. So we are now about to engage the process of delivering 20 samples of this. These are all handmade prototypes. We're going to deliver 20 of these to surgeons in Liberia and Ethiopia, and we're going to undertake that same process, ensure that that the surgeons are comfortable with the headlight, that the strap works well for them, that it's comfortable on the head, and that it is fit for purpose for their uses. The light quality from this headlight is actually fantastic. I've spent several hours wearing it around my own house and using it to look at things, and the light quality, it's a beautiful color. It gives lovely tissue color rendition. And so we're really excited. And this price point is a fraction of the cost of most medical and surgical grade headlights. So it's finally a price point that is one that we believe not only we can distribute in bulk through kind of donation style approaches, but also one that we believe that surgeons, once they feel comfortable and confident that this is a high quality headlight, will be able to afford to purchase out of pocket, which in many ways is kind of the ultimate kind of consumer expression of confidence. So our goal is to distribute 20,000 of these headlights and get them into the hands of providers in these contexts over the next 5 years. That's about 5% of the target market. And so it's a huge goal. We're pretty confident that this last prototype is the final prototype, or at least it's kind of our Gen 1 prototype that will be distributed. And we're looking forward to the feedback, and then we're looking forward to getting this into the hands of providers and hopefully improving surgical safety for these patients. I want to thank a lot of people. So a whole team in Ethiopia. So Dr. Tithana, who's one of my partners in crime, is a pediatric surgeon in Black Lion Hospital. Sanait is the head of programs of Lifebox Ethiopia. Nicole Starr is a surgical resident from UCSF who's working with us. Nina Kapachichi is a medical doctor in Benin who's been doing a lot of work in Western Africa. Muad is a medical student from Karolinska. I want to give a couple of other special shout outs. So Graham Rosenberg did a phenomenal job of doing some work here at Stanford, trying to requesting surgeons to try some of these headlights out and soliciting some feedback. But really, I have to say that this effort was entirely up to this guy. So Jared Forrester has done a phenomenal job of helping identify this as an issue, of driving the work in Ethiopia, of developing the partnerships that have made it happen. And I'm really, really excited for you, Jared, for the next stage of your career. And I can't thank you enough for the amount of work that you've done to make this project a reality. So I'm going to stop there, and thank you so much to the department for the support, and we're really excited to take this forward.